and welcome to Joy in Our Town. I'm your host, Adrienne Carr. Joy in Our Town brings you the issues and problems that are faced in the local community with the hope of finding a solution. Our guest for this segment is Licking County Health Commissioner Joe Ebel. And Mr. Ebel is here to discuss the importance of proper hand washing in the wake of cold and flu season. According to the health commissioner, parents and teachers should take the time to practice proper hand washing in order to set a good example for children. Good morning, Mr. Ebel. How are you?
Great. Thanks for having me.
Wonderful. Now that we're in the winter season now, what can you tell us about the flu virus?
Well, typically this is flu season in Ohio, and it kind of varies. We start, giving flu shots in September, but flu season really runs all the way into February and March even. This year we have been fortunate. We haven't seen a lot of flu activity yet. But if we looked at last year, it was kind of the same thing. We saw the flu peak actually at the end of January, first part of February. So we're not out of the woods yet.
So do you think that the flu shot is really necessary? Who should get the flu shot, and exactly what is it?
Well, the flu shot basically is a vaccine against 3 different strains of influenza. And there's lots of strains out there, but they every year look at it and say, what are the 3 most likely to be circulating? And that vaccine boosts your immune system so that if you're exposed to that virus, your body's already ready for it and can fight it off effectively. Basically, what CDC recommends is that everyone from age 6 months on up should really have the flu shot. Really? And it's important, even if you're in a household with someone that is less than 6 months old, that everyone that is around that child get the flu shot. Because although the child's too young to get the vaccine, they're not too young to catch the flu. So it's important that parents and caregivers all get vaccinated to help protect that infant.
So I've heard sometimes, though, that when you get the flu shot, you end up getting sick. Is that true, that it makes you get sick?
The normal flu shot where you get an injection is a dead virus. It's inactivated, so you really can't get the flu or flu-like symptoms. All you normally would get would be a sore arm or something along that. There is the nasal spray type of a vaccine that you can get, and that a lot of times people will get a kind of a runny nose or cold-like symptoms with that, kind of a mild symptom. So that one isn't recommended for people who have health problems or are pregnant, things like that, where the shot's pretty much recommended for everyone unless they have an allergy to eggs or have had a reaction to the flu shot in the past.
So is there a difference between the cold and the flu? How do I tell the difference?
Well, it's pretty tough. And when we say, flu-like symptoms, people think of everything, and really what we're talking about is a respiratory illness. You've got a cough, probably a runny nose.
What about asthma? If I suffer from asthma, should I get it?
Oh, if you have someone with asthma is very high risk for complications from a flu, just like someone with other health conditions like diabetes or a heart problem or any kind of a chronic health issue. That they're really the first people that should be getting that vaccine at the beginning of the year because their bodies aren't as ready to fight off the illness. But with the flu, compared to the cold, usually with the cold you don't really have a fever. The flu typically you do. And the flu is just a much more severe illness normally than what cold is. Cold, you're usually limited more to your head and runny nose type of symptoms. And the flu can get into your chest and coughing and have fever, achy body, those kinds of things.
So prior to residents getting the flu vaccine, are there any precautions that you would recommend that they take? Or
basically all the places that you see that have the flu shot have pretty much the exact same thing. The CDC says these are the 3 viruses that we think will be circulating, and that's what's out there. So you can pretty much get it anywhere, which is great. There's really not a reason to not get the flu shot. There have been years where we've had shortages, and that causes people to get in big lines and that, but we haven't had that recently. So the main thing was get it as early in the flu season as you can, if it's in September, October, whenever you can get it. But it's also really never too late to get the flu shot. So even though we're getting into the kind of meat of flu season, it's not too late to get that vaccine.
Well, what's the significance of this hand washing? I mean, can you really prevent getting the flu from just washing your hands?
Well, the flu can be spread, either by coughing and you inhaling the droplets, so you don't want to be face-to-face with somebody that's sick.
Wow.
But they can also cough or wipe their nose or whatever, touch surfaces, and then you can, especially if you touch your eyes or your mouth with the dirty hands, you can spread that. So that's why really the hand washing is important for someone who is sick, so that they're not, if they're sneezing and using a tissue, they can throw the tissue away, but they also need to be washing their hands. And then for healthy people, they need to be washing their hands because they're touching things that other people that may be sick, have touched and can spread the disease that way.
Well, I mentioned a little bit earlier about parents and teachers. What's the significance of parents and teachers?
Well, teachers usually are kind of in the incubators in the schools. You have all those kids and lots of disease coming in and out, and so they're really exposed to a lot there. So it's important, for them to get vaccinated, and for parents as well, and especially for parents as caregivers. If your child gets sick, you still have to take care of them. You want to make sure that, hopefully you've got them vaccinated, but you've also got yourself vaccinated so that, you're a little bit safer to take care of them. But you also want to keep that sick child away from the rest of the healthy family as much as you can. Try to get them in an area that's not where all the rest of the family's hanging out, so you don't end up spreading it as easily through the whole household.
So would you recommend, if an adult or a child seems to be coming down with the flu symptoms, that they not go into the public or go to school or go to work? I mean,
normally what we say is, if someone's sick, especially if they have a fever and those kind of flu-like symptoms, is to stay home from work or school until 24 hours after their fever's gone. And that's not the fever gone with taking, aspirin and things to try to reduce the fevers. It's having the fever go away by itself. So if you do that, then that hopefully breaks the cycle and they're not spreading it back at work, and you're really doing your fellow employees and employer a favor by not coming in.
Folks in restaurants and servers and those who work with the public a lot, huh?
Yeah, and it's very difficult sometimes to convince people who are hourly workers to stay home when they're sick because
Absolutely.
they don't get the sick leave. So that can be a challenge.
So employers have to be a little understanding.
Or at least the employer needs to be saying, you look sick, you're sick, you just need to go home, we'll cover for you.
Well, Mr. Ebel, what about hand sanitizers? Can I just use hand sanitizer? I can't just wash my hands all the time, So in emergency situations, do they work?
Yeah, the alcohol-based hand sanitizers, like we always see, work real well as long as your hands are clean. So, if
my hands are clean, why am I going to use it?
Well, I mean, like my hands look clean, but I'm sure there's bacteria on them.
Okay.
But if you've been making hamburgers and you've got, actual food particles on your hand, the sanitizer is not going to work that way. So washing your hands to get the dirt kind of off
I see.
is important. And then in between those actual hand washings, the sanitizers work real well.
Well, is there a proper way to wash your hands?
Well, the main thing is washing it frequently with running water. You want to rub your hands together because that actually, breaks the dirt and things off your hands. And also do it with soap. The antibiotic or disinfectant kind of soaps aren't really any better than any other soap, is what they've generally found. But use the soap, running water, wash your hands for at least 30 seconds. Or if you want it to, like, sing happy birthday to yourself 2 times, and then you'll know you've been washing them long enough.
What about the temperature of the water? Does that matter?
Not really. I mean, warmer water will tend to get rid of most of the dirt and the oils better, but running water is important because that's constantly flushing the dirty materials off your hands.
Are there any other methods that you would recommend for keeping yourself clean or helping to prevent spreading the germ to other people?
Well, the main thing is, covering your cough. So if you're going to cough, What they teach all the kids now is to cough into their elbows, which is hard for me because we were told to cover with your hands, but obviously then you go ahead and use your hands for something, it kind of causes a problem. So covering your cough, using a tissue when you sneeze and throwing the tissues away, making sure that you're not in close, face to face with somebody who is sick. If you have a sick child, you're not holding them right in front of your face. Hold them over your shoulder if you have to carry them around. So when they cough, it's not right onto you. So there's lots of little things you can do to try to protect yourself and others.
Any last minute ideas or thoughts that you want the public to know?
As far as treatment for the flu, if you go to the doctor and you go early enough, there are antiviral medications now that can help really limit the severity and how long the flu lasts. So if you do go to the doctor and they do a test and say it's the flu, and they give you a prescription for an antiviral, get that, because the sooner that you can get it, the more chance that has to actually kind of help you defeat the illness.
Okay, well, thank you, Mr. Ebel. And coming up next on Joy in Our Town, Crime Stoppers will share with us some valuable safety tips. So don't go away. We'll be right back.